meeting, and this is the Health Department's Town Hall meeting. And again, I want to thank everyone. My name is Nicole Garner, and I will be your moderator this morning. Next slide. And so before we get into the presentation, I want to go ahead and go over the agenda. What we're going to talk about this morning is updating you on the new local health orders. We're going to discuss trauma-informed conflict by Chandra Green. We're also going to update you on the COVID guidelines for your workplace. We're going to also discuss the CDC new guidelines. We're going to talk about frequently asked questions and have you have the opportunity to go over those. We're also going to go over resources for employers and employees. And then lastly, we're going to talk about or have a Q&A session. And also, please don't forget to submit any questions you have in the Q&A box. Next slide, please. All right, and so our panelists this morning would be myself. Again, I'm Nicole Garner. I'm the Planning and Operations Manager here at the Health Department. We also have Janelle Friesen, who is our PIO Officer at the Health Department. We have Haley Shoemaker, who is our epidemiologist at the Health Department, and then Chandra Green, who is the director at Alive and Thrive at Wyandotte County. All right, and I'm going to turn it over to Haley Shoemaker, who's going to discuss the new local health orders that were put in place effective November 20th. Haley.
Great, thank you so much, Nicole. Awesome. Thank you so much, Nicole, and thank you so much to everyone for being here this morning. So let's talk first about what's new about this order. So if you own a restaurant, seated parties at the restaurant are limited to 8 persons. For recreation and entertainment venues, the maximum occupancy of the venue is limited to 50% of the fire marshal capacity. Bars and restaurants must close by 10 p.m. That 10 p.m. closing means that the guests are out the door, not that last call is at 10 p.m., just to be clear. And drive-through and delivery services after 10 p.m. are still allowed, but no takeout. The idea here is that people should not be coming in from the public into your place of service after 10 p.m. And then gatherings are limited to 10 people, and that can be a little bit confusing, so we're going to talk about that again later in the presentation. So what old orders are still in place? Well, we know that we're supposed to still wear a mask. Outdoors is 6 feet, cannot be continuously maintained in our group. We're supposed to be wearing a mask if we're indoors at all times, unless you are in an office by yourself with the door closed, like we are right now. Space must also be permitted for social distancing in both private and public businesses and in public spaces, both for your employees and for your customers who are coming in to visit. Okay, so some people wonder why we mandate that restaurants close at 10, and Kansas City, Missouri has actually done this exact same thing because we believe that closing at 10 p.m. will help to curb the spread of COVID. At late hours and when people are drinking alcohol, they are less likely to take precautions around making sure to keep social distancing from people who don't live in their household and wearing masks, et cetera. And it can be very easy for COVID to spread in that situation. We also know that adults, young adults aged 20 to 29, constitute the largest number of cases, new cases in Wyandotte County. And we know that this age group can spread COVID to many others. And even if they don't become very sick themselves, the people around them can become very sick. So that's part of the reason why we instituted this 10 p.m. closing time. So let's talk a little bit about this 50% capacity versus 10 persons rule. I want to clarify that the 50% capacity applies to entertainment and recreation venues as specified in the order. If you're not sure if your venue falls into either one of those categories, please see the text of the order and you'll be able to tell. But otherwise, what this means is that groups of up to 10 persons in a setting where social distancing cannot be maintained continuously can gather. So this applies to things like weddings, parties, social events, competitions, performances, etc. If you're going to be gathered in a group at an entertainment venue where you're not sure that you guys are able to maintain social distancing, maybe you're eating, drinking, bowling, dancing, whatever it is, that group is limited to 10 people. And that means that you shouldn't have 11 people in a group that size, and you also shouldn't have 2 groups of 10 people who are able to intermingle. However, if you look at the scenario on the right side of your screen, you'll see a situation where there are more than 10 people, but the interaction is brief or intermittent. They're not all spending time all together within within 6 feet of each other, may or may not be wearing masks. And in that scenario, you can use 50% capacity if people are only like crossing paths in the hallway, that kind of thing. So one example I can think of is a gym. So if you are running a gym and you have the gym set up in such a way that people can social distance and using the equipment and the treadmills, you can have more than 10 people in the gym. You just have to provide that there is social distancing between those people, because we're assuming that people aren't going to the gym to run on the treadmill next to another person who's also running on the treadmill. I hope that makes sense. But if it doesn't make sense, please feel free to ask questions in the Q&A box and we'll address them at the end. Okay, here's yet another summary of this 50% versus 10 persons rule. So mask and social distancing apply to all businesses across the board, this blue triangle. The orange triangle for 50% capacity applies to entertainment and recreation venues, right? The 10-person gathering limit mostly probably falls in that recreation and entertainment venue triangle also. So if you're having a gathering of 10 people that are all together and you might not be able to guarantee social distancing and mask wearing, that's the limit size of that group. We don't encourage people, to be very clear, we're not encouraging people to gather in groups of any size with people outside their household without masks and social distancing. But if it must be done for some reason, the limit of that group size is 10. So feel free to ask questions about that in the Q&A box. So if you own a personal service, like a salon, for example, the waiting room in the service area must offer socially distanced seating, and the employees and the customers have to wear masks, unless momentarily they cannot be worn, like if it's a facial or something doing with the mouth and the customer can't wear the mask momentarily. It's the same at the dental office, but everyone else should be wearing a mask. And then we recommend that you keep occupancy to 50%, but because you're not specifically stated in the order, there's no 50% requirement. There is a social distancing requirement. Okay, if you'd like to have a larger event than 10 persons that could all be sort of mingling together without social distancing guaranteed, you can submit an event request form at this link. We'll send you out a copy of this PowerPoint. You can click on the link to submit an event request form. And we will ask you for what COVID mitigation measures you're going to have in place at the event. And we ask that you please submit this 3 weeks before your event, and we'll get back to you. This really does happen. People do submit these to us, and we do respond. So we ask that you please submit these to us. Private businesses still fall under the order in Wyandotte County. So whether you consider your business private or public, you still have to follow masking and social distancing rules. And if you're an entertainment or recreation venue, these other rules in the new order also apply to you. This order, this can be a little bit confusing, but this order does not affect sports, team sports, because school and club sports are under a do not play recommendation, but not an order. However, because sporting venues are entertainment or recreation venues, the 50% capacity rule does apply for fans, and masks and social distancing are required for fans. Masks are still required for players in sports. Just to make that very clear, just because it's a sport that's indoors. Like, for example, if you have two soccer teams playing against each other, it's possible that, there's 22 people on the field. So it's possible that there's going to be closer than 6 feet interaction between people playing the soccer game, right? The people playing the game are still technically required to wear masks under the order. However, because it is a sport, the 10-person rule doesn't apply, because school and club sports are under a do not play recommendation and not an order. Again, if this is confusing in any way, please submit a question in the Q&A box, but I hope this makes sense. I did also want to mention that we have 2 new health inspectors who are going around to different businesses and just checking to make sure that they are doing their best with regards to COVID mitigation, prevention, preparation strategies. So they have done 103 visits. They've done more than this. This was current as of Monday. So they do about 4 or 5 visits a day. When we get a complaint about a business not following orders, we can generally respond to that complaint in less than a day. Most of the places we've had them visit are restaurants, gas stations, and grocery or large retail stores. We've done 95 first visits, 6 second visits, and 1 third visit, although most businesses do comply after 1 visit. And our focus is on education, so we have not written any citations as of yet. I did just want to share with you some of the results of our compliance inspections. The first one is that as a county, we can do better in terms of employee screening. So what does that mean? When employees are coming into your place of business, to work, you should ask them, have they had any symptoms of COVID? And you should show them a list or give them a list verbally or on the phone, on a piece of paper, congestion, sore throat, runny nose, headache, shortness of breath, diarrhea, nausea, vomiting. There's a whole laundry list of symptoms outside of only fever. And you'll be able to catch some employees who are sick before they come to work over just using a temperature scanner alone. Although we also recommend that you scan employees for temperature as they're coming into work. We also realized from some of our inspections that mask compliance is moderate. So in about 25% of places that we visited, we saw at least one employee with no mask. Not that they were attempting to wear one, but it was incorrect, but just no mask whatsoever. And then in another 25% of businesses, we saw that at least one customer was not even trying to wear a mask, no mask at all. So this isn't terrible, but I think we can do better. Ideally, these numbers drop down to 0. And finally, social distancing is good. Roughly 80% of the businesses where we reported this statistic, they did report that social distancing could be maintained inside the store. But only 30% of them were using floor markers. And what I mean are the big stickers on the floor that say, like, please stay 6 feet apart, that you can put 6 feet apart to show people where they can wait in line. We have lots of these stickers, so if you want them, please contact us and we'll be very happy to send you some, or we can send our inspector out with some stickers. So please feel free to contact us for that, or any other resources like posters about mask wearing, social distancing, hand washing, etc. Okay, I'm going to pass the mic back over to Nicole.
Thank you, Haley. And this is a nice segue. I don't know if you all feeling, I'm sure you're all feeling that COVID fatigue and having a lot of stress and trauma actually due to COVID. And so I want to go ahead and introduce Chandra Green, who's from Alive and Thrive of Wyandotte County, and she's going to actually discuss trauma-informed conflict resolutions and give you some tools and tips on how to deal with that. So.
Thank you, Nicole, and thank you to the rest of the team for having me here today. As she said, my name is Chandra Green. I am the director of Alive and Thrive Wyandotte County. And just a real quick overview of who we are and what we do if you haven't heard of us yet. The purpose of Alive and Thrive is basically to help promote and support a healthy, safe, and welcoming Wyandotte. And we do this through education and awareness of trauma with the focus of ACEs, and that's the adverse childhood experiences and the adverse community experience. And by doing this, we're assisting the community in creating and establishing projects that support resilience and healing within our community. Okay, so let's start by just basically addressing trauma. I recently did a survey with a group of people, and I asked them, have you ever experienced trauma? And for a couple of them, I did get a couple of no's, and that was a little concerning to me in today's climate, but I'll get into that in just a little bit. But let's give a definition of trauma, right? Trauma basically results from an event, a series of events, or a set of circumstances that is experienced by an individual as physical or emotionally harmful or life-threatening, and it has lasting effects, adverse effects on the individual's functioning and mental and physical, social, emotional, or spiritual well-being, right? So basically it's something that just interrupts your pattern in an adverse way that you were just really not expecting, right? As a matter of fact, after we experience an event, we go into what is termed a trauma response. That's the fight, flight, freeze. And recently we added a piece to that, right? So, and the best example I like to give, a lady named Dr. Nadine Burke-Harris, she did a video regarding ACEs, and she gives this example of if you're in the forest and there's a bear. You know, I don't really know too many people who will fight the bear, but they may go into like a fight mode where if there's people around them, they may want to protect and, you know, get everybody together and, or either try to even in some ways harm the bear if they're able to do that. Some people will just run and some people will just stand there like, I cannot believe this is happening to my life right now, right? And so when it comes to the appease part of it, it is when a person is in a situation that is constant trauma around them. But in order to keep it from happening again, this is where we start talking about the cycles of trauma. In order to keep it from happening again, they just kind of try to make everybody and everything around them work and be happy and try to keep things as calm as possible to keep it from escalating again. The thing about it is that we've normalized trauma in such a way and made it a way of life that most people do not even realize or recognize life stressors as trauma. They just think of it as, well, that's just how it is, or this is the hand I've been dealt. And we also tend to look at people without thinking about trauma, but we'll look at them and say, suck it up, buttercup, or how long are you gonna let that bother you? You know, that happened 10,000 years ago. So we would have to understand that our brains are not actually meant to deal with trauma and traumatic events. In fact, trauma literally reshapes our brain, and it can have long-lasting effects, shortening our chromosomes and contributing to a shorter lifespan by increasing health disparities for us. Like stress, you know, even when it creates more cortisol in our system, that can lead to weight gain, or just worrying can lead to even tumors and things of that sort. So just being aware of how trauma can affect our bodies is very, very huge, right? And the whole thing is to admit and to recognize trauma. That in and of itself can be very eye-opening, because that means you have to deal with it. And it's inconvenient to have to deal with it, right? It's a lot easier sometimes to say, I don't want to deal with this. Let's just keep going. Let's just keep moving. Because to deal with it means we may have to open up a can of worms. We get what we call emotional. Then we have to deal with all of that extra stuff. But then we find ourselves coming right back to it one way or the other, because we never actually dealt with it, right? And the focus when it comes to business and the business world, we really don't have time for this, because the focus tends to become more on the mission of the business and not really the state of the people that are carrying the mission out, right? The thing is in the wake of COVID, COVID and civil unrest, let me say that, we all have directly or indirectly had to deal with some level of trauma and have found ourselves living in a trauma response. If you're not constantly trying to figure out how to reshape your business to address COVID, if you're trying to address or figure out how to deal with your staff who may be sick, or may have family who's been sick, or you yourself have been sick, or family and friends around you close to you may have been sick. I mean, that is all trauma related, and it stacks on top of everything. And add to that the news and the civil unrest that is going on, it just becomes a whirlwind of continual trauma that sometimes we're just like, if I just push through, I'm gonna be okay, right? And for business wise, we may have successful businesses, but how more successful would it be if people actually felt safe and important in their establishment? And on the flip side, if a business is having high turnover, I would still invite that business to also take a look at how safe and important the staff feels. So I'm gonna just kind of jump into three quick points. Now I realize this is a quick overview due to time, and we could always go a little bit deeper when we're talking about trauma, but I wanna give you 3 quick points when it comes to our organizations, our businesses, and how to be a little bit more trauma informed during this time. The first thing I want to say is transparency. Be clear, be upfront, be honest about where your business is with your employees and with your customers or clients. Have plenty of meetings to inform them of where you are. Have signage up so that there's no question about where you stand. If it adds more trauma if I have to all of a sudden the business closes, or I'm not going to get a paycheck next week, you know, and then I have to try to find resources, versus if this has been a conversation and I've had time to prepare or know what's going on. So if all else possible, please be just as transparent as you possibly can. Second, let's offer choice where possible. I know that that even with the new regulations and the policies that are in order, that can be kind of hard because there's some strict things that we just have to follow. But even around those, how can we safety plan around those things that we can't control with our staff? You'll be surprised the minds you hired these people, right? So they are there for a reason. They know the business. They are creative. They are talented. They have something to offer. Talk to them. They may be able. I know we have have to wear masks, but maybe we can go outside if we are getting overwhelmed because we're breathing it in all the time. Maybe our brakes can change or something like that. So, and you may have a financial genius in your midst and not even know. So if you're having some financial issues, they may have heard about a grant that can help your business or some other funding that can help your business. Just offer choice and have those conversations. Empower yourself and your workers. Because you never know what can be worked out. And it also allows them to feel included in the process so that they're not feeling overwhelmed and just being told what to do. And even when it comes to customers, you know, they may not want to comply with wearing a mask. What are their other options to engage with your organization or your business? If you have clear signage, if you're notifying them of this is what our procedures are, and this is what we need to do so that they're not surprised when they walk up to the door and they know what to expect. But if they do happen to walk up to the door, how can we invite them to go to the website or to order service online or to do other things versus come in and put what you put our staff and our organization at risk. So I would say be collaborative. When all else is done, be collaborative. Again, like I said, you never know the skills of the people who you have around you. But this also flows into the other two, right? When we're offering choice and when we're being transparent, we want to make sure that we have a good number of people, whether you are a LLC or a nonprofit with a board or a steering committee, pull people in. You know, a lot of times we're overwhelmed and we don't realize how overwhelmed we are. And we're thinking through a certain lens. And so we may not see other ways or other options. So don't be afraid to bring other people in, including your staff, on those conversations. And I want to offer this other option through Kansas Leadership Center. They have a program called Kansas Beat Virus, and it promotes collaborative conversation to deal with the virus that's going on. And I'm working with this through an organization called KC United, where we're facilitating 1-hour conversations to just kind of address what an organization can do, what a business can do, what a group of people, your family, your friends can do to address COVID. And it also comes with a $3,000 grant, or up to a $3,000 grant, if you can come up with the project that you would like to do. So if you're interested in that, that would be great for your business. I tell people all the time, we're wearing masks and we want to be cute in our masks. So get some with your logo on them, or, you know, get you some sanitizer, PPE, or whatever you can do. Or even if that just means let's do some more mailers to get the information out a little bit more, whatever that looks like for your group of people, feel free to contact me to get that information. I know it's on the next slide, I believe, Haley, with my email and my phone number, and we can definitely work that out. Or even if you're interested in having this whole conversation about trauma and how it's affecting your organization a little bit more, feel free to reach out to us at Alive and Thrive, and we'll be glad to work out something, or we'll just have another big meeting like this to address it, depending on the interest. So yes, this is a real quick overview, real quick hit it and quit it, but there is a lot more to it. So like I said, contact me if you want more information. And I'm going to turn it back over to Miss Nicole. Thank y'all so much.
Thank you so much, Chandra. That was great information. And it's so interesting because I, in fact, thought I was just dealing with stress when COVID-19, struck us in early March, but soon found out that it was in fact trauma. And in fact, our leadership team is reading a book called Trauma Stewardship. And so I encourage anyone who has a team to read that book. It's a great book for your leadership team if you want to learn how to deal with trauma in the workplace. And so with that said, I'm going to actually turn it back over to Haley, who's going to provide us with an update on employee tests, if an employee tests positive for COVID-19. Haley.
Thank you so much, Nicole, and thanks so much to Chandra as well. If some of you were on our town hall presentation back in September, you'll recognize a lot of this information. but I'm going to go through it again because there might be some people who haven't seen it before, and also as a refresher for those of you who have seen it before. So without further ado, let's go ahead and get started. All right, so if your employee has COVID, what do you do? There's kind of a cycle of how we respond to COVID in a workplace. If the first step is respond, the second step is isolate or send people into quarantine at home. The third step, they return to work. And the fourth step is that you monitor the situation. If no one in your workplace has tested positive for COVID, ideally you just remain in this number 4 arrow for as long as possible until the pandemic is finally over at some point in the future. But let's suppose that you do have an employee test positive or they come into work sick. What do you do? So we're going to make sure the sick employee is able to go home. We're going to clean their workspace. We're going to collect some key information from that sick employee, contact the health department, and do contact tracing. And we'll go through all of those points. All right, so if you have an employee who comes to work ill, ideally you can catch these employees through that screening survey that I talked about before, which can really take any form. You know, you can use half a piece of paper, you can send them a text message, you can give them a call, you can have them look at, minimally, you can have them look at a poster of symptoms and state verbally that they're not experiencing any of those symptoms when they come into work, which just takes a couple of seconds. So there's a lot of ways to do screening. But if you do find an employee who says they're ill, you should send them home to isolate for 10 days from their onset of symptoms. Now, there's a lot of situations where maybe an employee just has one symptom, like they just have a headache, or they just have a runny nose, or they just have a sore throat. Those situations can be a little bit trickier. You can, if they have any symptoms of illness and they haven't tested positive in the last 90 days, we would encourage you to have them go and get tested for COVID, even if they think that it's allergies, if they think that it's something else. In this scenario, it's always better to be safe than sorry, and we are seeing a lot of community spread here in Wyandotte County. So if you have an employee who's ill, even if it's just a mild illness, even if they have seasonal allergies every year, we really do recommend that you send them to get tested. And if they do test positive, they're going to isolate at home for 10 days from symptom onset. Now, we know that some people who have COVID symptoms and were exposed to COVID test negative. In this scenario, please contact the health department and we can help you walk through what to do. But in those situations, when you're sure the person was exposed and they have a certain set of symptoms, essentially more than one symptom for most symptoms, especially if they have any kind of difficulty breathing or coughing or loss of taste and smell. In those kinds of scenarios, to be safe, you can have them get tested again, or you can just presume that they are positive and have them stay out for the full 10 days. So these situations can get kind of tricky pretty fast, and you can feel free to reach out to me for more clarification. But the general rule is if somebody is sick, please send them home to isolate, have them get tested for COVID. If it's positive, they're going to stay home for 10 days from the onset of symptoms. If they don't have any symptoms, the 10 days begins on the day that they were tested. You should evacuate that employee's work area for 24 hours if you can. And then you can clean surfaces around where the employee was working. 2 really common, relatively cheap chemicals that are rated to destroy COVID as any 70% alcohol solutions, that's ethanol, isopropyl alcohol. Please don't use methanol. Methanol is really toxic, we know. So if you want to use 70% alcohol to clean surfaces, hard non-porous surfaces, that's fine. Or you can use 1/3 cup of bleach, 5 to 8% bleach in 1 gallon of water. If you want to know if your current chemical that you're using is rated to destroy COVID, please look on the EPA website. They have a very full list there. You're going to want to gather some certain information from the employee who is sick. You want to know what day did they start feeling sick? What day did they get tested? Sometimes you find out that an employee is positive after they've already gotten sick and been tested, and they just call you afterward and inform you. So you might need to get this information from them. You also want to know what was the last day that they came to work. When was the last day that they were around other people? And then collect from them who they think their close contacts are. So maybe who were they sitting next to at their desk? Who were they working next to on the production line? Who did they eat lunch with? Who did they carpool with? We're going to go over contact tracing in more detail later, but collecting these close contacts from the case will help you do contact tracing. Next thing you can do is you can contact me at the health department. This is my email address. If you're a business owner, I welcome you to email me anytime. This is my phone number for my office. However, I get a very high volume of calls. So if you call me and I don't pick up, please send me an email. and I will get back to you as soon as I possibly can with an answer to your question. You can ask any questions by email. That email address is confidential, so you can rest assured that information you send me doesn't leave the health department. And then we will give you additional guidance on what you can do in a tricky situation. So why do you need to contact trace? You should contact trace in order to prevent spread of the virus in general, but absolutely to vulnerable populations, people over the age of 65, people with comorbidities, background health conditions who stand a higher chance of getting very, very sick from the virus. The key reason to contact trace is because COVID can spread before people start to feel sick. So let's say you have an employee who gets sick at work, and they leave work, they get tested, they find out that they have COVID-19. So you look at who they were working with, and you find out that they're working with Jane and John. So Jane and John were both working in close contact with the person who tested positive. Jane and John should not stay at work until they feel sick, and then you send them home. Because if you do that, it's already too late. Then you'll have to go through and figure out who Jane and John were next to, and then send all those people home when they feel sick. And the whole thing just continues to snowball. If you instead, as soon as you realize that Jane and John were in contact with a positive case, you send them home, then if either of them falls ill, they're at home. And so they're not around any of your other employees. And so you stop the spread of the virus within your business right then and there. This is a really key point because whenever you're doing contact tracing, you have to note that COVID can spread 48 hours before somebody feels sick. So if I'm around my cousin Brian today and we eat lunch together, and tomorrow I start having a headache, runny nose, cough, muscle aches, and fever, then Brian was exposed to COVID even though I had no symptoms on the day that we ate lunch together. That's part of the reason why COVID has become a global pandemic, is because it spreads from people who don't know that they're sick or they're about to fall very sick. So let's get into the details of contact tracing. First, what is a close contact? This is in the first box on the left, so please follow with me. A close contact is anyone that you've been within 6 feet of for 10 minutes in total in 24 hours. So 2 minutes here, 2 minutes there, 2 minutes here, 2 minutes there. If it adds up to 10 minutes in 24 hours, that is a close contact if you're within 6 feet of the other person. It doesn't matter if both of you are wearing masks, and I will go into that in a little bit. Like I said before, COVID is contagious 48 hours before you start feeling sick. So you have to go back to 2 days before the sick person began feeling sick to start your contact tracing. You should also include any day that that person worked while they were ill. And then in the last box on the right, it says any close contact should quarantine at home for 14 days. I know the CDC just came out with some new information about that. We're going to get to that. And I also noted here on the slide, contact tracing resources are currently really strained at the health department. And so we are really asking for your help. We need your help to do contact tracing within your own business. Now, I'm not asking you to go back, and find out if your employee went to a Halloween party with their friends and then, went out to, Buffalo Wild Wings or did this or that. That stuff, that's our job to handle that. Their personal network of contacts is the job of the health department to figure out. But within your business, within your company, we ask that you help us by doing that contact tracing within your company. Okay. So again, if an employee is sick and has tested positive for COVID, or they're what we call a probable case, that is, they were exposed to COVID, they have multiple symptoms of COVID, or certain key symptoms like respiratory symptoms or loss of taste and smell, and they were exposed to COVID, you should have them stay out for 10 days from their onset of symptoms. As long as they don't have a fever for 72 hours and there's a general improvement in their symptoms, after that 10 days is up, they can come back to work. So let me be very clear. There's a 10-day total from the onset of symptoms that they have to be out. The last 3 of those 10 days, they cannot have a fever. If at the end of the 10 days, they still have like loss of taste and smell is lingering, maybe they have a headache or a little bit of a runny nose, but mostly they feel fine and they want to come back to work, then you can have them come back to work, provided they've been fever-free that 72 hours. And it doesn't count if they're taking fever-reducing medication. So if they're really sick and they're just taking a bunch of fever-reducing medication to prove they don't have a fever, that doesn't count. They have to be fever-free for that 72 hours without fever-reducing medication. Okay. For contacts of positive cases, so contacts are employees who have not yet tested positive. They may not even be sick. They may feel completely fine. They should quarantine at home for 14 days from their last contact with a positive case. And they should get tested 7 to 9 days after they were exposed. We'll explain that a little bit more later. Even if this test result comes back negative, please have the employee stay home for the full 2 weeks. I'm going to go through this again because this is really important. If you have an employee who's in contact with a positive case, they need to stay home for 14 days from that date of contact with the positive case. They should not get tested right away. I like to say that COVID spreads easily, but not quickly. It's not like food poisoning where if you eat some bad chicken, then tomorrow you're already going to have a stomach ache. Most people get sick about 5 days after they were exposed to COVID. So if you were exposed to COVID today and you get tested today, that test result is useless. It's probably going to be negative, but it says nothing about whether you're going to get sick in the future. So please wait 7 to 9 days after exposure to get tested. Okay, here we go. So how are you going to get your employees back to work? So once they've met the quarantine and isolation guidelines, they can return to work safely. Please do not have positive employees get retested. Please do not have positive employees get retested. Please do not have positive employees get retested for COVID. We know that people can continue to test positive for several weeks or even months after their original positive test, but this does not mean that they're still contagious for the virus. The way that the test works is that it picks up little pieces of RNA from the virus. And so if you have little remnants of RNA from the virus in your system, the test will pick it up and say that you're positive. However, we know that 10 days after your onset of symptoms, you're no longer contagious. The little pieces of the virus that remain are not a virus that is able to infect other cells. So those continuing positive tests do not tell you if the person is contagious or not. And so please use those dates from onset of symptoms for them to come back, and don't rely on them testing negative to come back. Thank you. If you need to get a test result for yourself, whether you as an employer, an employee, or just anyone that you know, we've been given permission to give out this phone number. You'll reach Doris here in the health department to get your test results. You can call this number. You can also request paper test results at this email address, and we will send you this PowerPoint. Due to the high volume of people testing recently, we're testing upwards of 400 people a day now, some days. We are unable to send letters in the mail to everyone who tests. This is a new development. So if you need paper test results, you can email COVID test results at WyCoKCK.org to request those paper results, and they will be sent to you. And please wait 72 hours after you are tested to call or email this number. If you test positive or negative, you will still get a text or a phone call letting you know that you tested positive or negative, usually within 48 hours of your test. But if you haven't received anything, please wait 72 hours before you call us or before you email to get those results. Okay, so I just want to go over quickly a few ways we can monitor for COVID. We can prevent COVID from even happening in our business. We can prevent this from being a problem. First thing is that you got to require your employees to wear masks. Even if it's uncomfortable, we understand it's not fun. Nobody likes it. But having your employees wear masks really will help prevent the spread of the virus amongst your employees. You can refuse entry to customers who don't want to wear a mask. You really can do this. And if they insist on coming in without wearing a mask, that kind of goes back to what Chandra Green was saying about offering them some alternatives like, oh, can you order online, et cetera, et cetera. Obviously, we're not asking you to engage with someone who might be very unhappy about not being able to wear a mask, but you can certainly post notices on your door that state that people have to wear a mask to come in. Please use symptom screening to catch employees who are sick that are coming into the office. They may not have a fever, but they may have other symptoms. You may be able to catch them early and make sure they get sent home before they have a chance to interact with other employees. You can use floor markers to help people maintain social distancing. That visual cue will really help instead of having everyone guess 6 feet. Reducing capacity to 50% is a really good rule of thumb. Again, the order only applies to entertainment and recreation venues, but any type of business can use this capacity rule to help guarantee social distancing space. We recommend lenient sick leave policies for COVID. If you can, we realize that businesses are struggling right now. At the end of the presentation, there is On our website, there are links to resources that you can look for businesses, small business loans and grants that you can apply for that might be able to help you. But if you have the funding to provide sick leave to your employees, maybe even on top of their regular sick leave, we recommend that you do this, because employees, if they don't think that they're going to have any sick time, then they might continue coming to work even if they're sick, and then you can have a COVID outbreak in your business because of it. And the last idea is that I know it's cold out nowadays, but if it's a warm day, or people are not cold, I guess you can open the windows, open doors, kind of like allow airflow throughout your building, with the exception of if people are working in their offices alone. Having the door closed will allow the person within the office to take their mask off. But otherwise, you can open windows and increase ventilation in areas where multiple people are working. Here's a list of COVID symptoms, just in case you didn't have one already. I won't go through them, but they're here in the PowerPoint in case you need to make reference back to this PowerPoint. And this list is not exhaustive. This just gives many of the common symptoms. Other things you can do, if you have employees who carpool, it doesn't hurt to remind them to wear a mask in the car. If you have two employees who are sitting next to each other, chatting on their way to and from work, that's an easy 10 minutes exposure and an easy place where COVID can spread. So wearing masks in that situation will help to curb some spread there. You can also close break rooms or reduce the number of tables to encourage people to sit 6 feet apart. You can also reduce congregation points, like places where everyone would go to get soda or water. You can put up a sign that just encourages people to come one at a time, or like wait 6 feet away from the person who's using the machine before they come and use it. Okay. We also recommend you keep a log of people who've tested positive and their close contacts. Please report if you have positive cases to me. You can send me an email anytime. And if you have a tricky situation with relatives or people coming and going, or you're not sure if there was close contact, or people don't want to talk about what really happened, anything like that, please send me an email. We deal with those situations all the time. We're happy to help. Okay, so I'm just gonna keep on going here and talk a little bit about the new suggestions from the CDC, which allot for a modified quarantine of 7 or 10 days. So first of all, let me talk about what the suggestion actually is. So the CDC has stated these options for acceptable alternatives to quarantine. They're only for people who have no symptoms. And these are, to clarify, these are people who are exposed to coronavirus, but who have not tested positive themselves, and they don't have any symptoms. So the CDC is saying that if you go for 1 week after your exposure with a negative test, and you test negative during that week, then you're free to leave quarantine. Or if you go for 10 days after your point of exposure, even if you don't get tested, if you have no symptoms, you can leave quarantine. These alternatives are not backed up by any new data that has come out about quarantine, or about the incubation period of COVID or how contagious COVID is. But the CDC is just trying to increase the number of people who are quarantined for any length of time. KDHE has said, so KDHE is the Kansas State Health Department. They have said that Kansas counties can either opt in to the CDC guidance, or they can choose to opt out and continue to use the 14-day quarantine protocol. So Dr. Lee Norman, who's the KDHE secretary, still recommends the 14-day quarantine period. And I should also note that the CDC also still recommends the 14-day quarantine period. They're just offering these other shorter periods as alternatives. So as you might expect, Wyandotte County, we're not going to change our quarantine recommendation because the incubation period for COVID is 14 days. That means that from the day you're exposed, it can be up to 14 days before you get sick with COVID. That hasn't changed. And since that hasn't changed, we don't see a reason why we should change the quarantine period. So quarantine is still 14 days from exposure. Please don't ask your employees to come to work during quarantine. We also know that the lowest chance of a false negative PCR test is 8 days after exposure. And so it doesn't seem to make sense for people to get tested on day 4 or day 5 and then have a negative result and leave quarantine on day 7. We know that those results are not as meaningful as results from day 8 in terms of whether or not you are positive. And we'll inform you if we make any changes to these recommendations. Okay, I'm going to pass the mic back over to Nicole.
All right, thank you, Haley. I always learn something new, even though I've seen that presentation. It's always good, a refresher for me. So I appreciate going over that. I always learn something. So thank you. Well, now let's get into our frequently asked questions. And so our first question is, and these are questions that we hear most frequently here at the health department. And so our first question is it still close contact if both people are wearing a mask at the same time? I think you've gone over that, but go ahead and give the answer. So,
Yes, yes, it is, because we know that masks reduce but don't eliminate risk of transmission of COVID. Masks are more protective, by the way, masks are more protective for other people than they are for the wearer. And so it's really in wearing masks that we're showing that we're able to protect each other. If everybody in a group wears a mask, they mutually protect each other, just so that you're aware of this. Masks don't eliminate the risk of transmission of COVID, however. And we also know that people don't always wear masks consistently or correctly. And here's just some examples of incorrect mask wearing. If it's not covering your nose, it's not correct. If it's not covering your chin, it's not correct. If it's not covering your mouth or your nose, it's not correct. So it really needs to cover your mouth, your nose, and your chin in order to be correctly positioned on your face. Thanks, Nicole.
thank you. The next question is, after you get COVID once, can you be reinfected?
The answer is yes, you can. The second infection may be more or less severe than the first. And I wanted to clarify that there's kind of two scenarios where you can get sick twice with COVID. The first one is you fall slightly ill and then you recover very quickly. You test positive, so maybe you're staying in isolation. And then all of a sudden, maybe 4 or 5 days after you started feeling sick and got better, you start feeling sick, you get better, and then all of a sudden you get really, really sick again. That's not you getting infected twice. Like, you're not getting COVID again from another person, but it's your first infection that your body was not able to fight off the vast majority of the time. And so that can happen. That does happen to some people. The other thing that can happen is that you can get COVID, you can recover, and then you can get COVID again, either the same strain or a different strain. And the only way to know what strain you got is if we do genetic sequencing of the particular infection you had the first time and the second time. But resources are very limited to do sequencing, and so we don't have sequencing results for most people. So sometimes it can be really tough to tell. But the end-all bottom line is, yes, you can be reinfected. It's very unlikely within 90 days because you have some temporary immunity to the virus that can last about 90 days. So once you've had it once, for the next 90 days, you don't have to go back into quarantine if you're exposed again. However, we still request that you continue to wear a mask, you continue to practice social distancing from other people, because there is always a chance you could be infected with a different strain within 90 days of the first strain. And there's also a chance that anything can happen because, again, research is ongoing in this area.
Great, thank you. Next question is, when should I send my employees to get tested for COVID?
Thank you, Nicole. So if your employee is symptomatic, they can come and get tested within 2 days of when they start feeling sick. Our Kmart location at 78th and State Avenue is open from 9 to 3. If you're exposed, you should get tested in 7 to 9 days after exposure, even if you do not have any symptoms of the virus. So either within 2 days of your onset or 8 days after your exposure. We say within 2 days of onset. So what if, for example, if I'm exposed on Saturday and then suddenly I get sick on Sunday? Well, that's too fast, probably, for me to have been exposed by that person on Saturday. But it's possible I was exposed by somebody else in the week before that, and I just didn't know. And so I should go and get tested when my symptoms start anyway, even if it hasn't been 8 days since I was exposed on Saturday. I hope that makes sense. We know that COVID spread is there's a lot of community spread of COVID here in Wyandotte County. And so you could have been exposed somewhere else and not known about it. And so you can still go and get tested if you have symptoms, even if it hasn't been 8 days. However, if you test negative, you can still go back and get tested again when you hit that 8-day mark after you were originally exposed.
Great, thank you. Let's see. If I've already gotten tested, I'm sorry. If my employee gets a negative test results, can I get them back immediately? Oh, and I'm sorry, I might have skipped the question.
No, that's okay. So we'll just do that one. So yeah, so if an employee does get a negative test result, can they come back to work immediately? So the answer is no. Once again, if you're exposed, that's day one. You get tested 7 to 9 days after that date of exposure. You're home for the full 14 days from the date of exposure, and then you can return to work on that 15th day after the exposure. If you count the days, it works out. Even though this looks like day 16, it counts out as being you're in quarantine for 14 full days, and then you can return to work. And I know this because I have an example in my head of a situation where an employee was sent home on day 1, they got tested, they came back negative on day 8, and then they went back to work on day 13, and on day 14, they left home, they left to go back home vomiting with a headache, and they tested positive. And because they had gone to work on that 13th day, they infected some other people at their workplace. So please, please, please allow your employees to stay home the full 14 days.
Thank you. If I've already gotten tested for COVID once, when should I get retested for COVID?
Thank you, Nicole. So if you've already been tested once, you should not test again for 90 days if you are positive. If you are positive, you don't need to get tested again for 90 days. If you're negative, you can always get tested again if you were exposed to COVID again, or if you have new symptoms of COVID. And really at our testing site at the Kmart, we're testing anybody for any reason. So if you want to come and get tested for any reason, as long as you live or work in Wyandotte County, you're welcome to come in and get tested. But we would suggest you get tested if you have a new exposure or new symptom.
Right. If someone in my workplace tests positive for COVID, do I need to shut down my business and get everyone tested?
Thank you, Nicole. So likely no, only close contacts need to quarantine. So if you have someone in your workplace who tests positive, only the people who are in close contact with that person need to go into quarantine. There may be other people in the workplace who are not exposed who don't need to quarantine. And if there's enough non-exposed employees who are available and want to work, you can remain open with them. You don't have to hire like a special hazmat team to come in and clean your business. Like I said, you can have, if you are able to evacuate the area for 24 hours, you can have you or anyone else can come back in and clean any of the surfaces with the chemicals that I mentioned before, or any other chemical you want to use that's rated to destroy COVID and also safe if you're using it in a safe way, wearing gloves, etc. You're fine to reopen. So just because all of the employees work in the same building doesn't mean that all of them were exposed. You really got to use that 6 feet for 10 minutes rule.
Right. Next question is, can I as an employer require my employees to get tested?
Thank you. So unfortunately, no, we can't require anyone to get tested, but you can require employees to stay home for a certain number of days based on their symptoms and exposure status.
How can I get proof of test results for my employee?
Sure. So if you are an employer and your employee tested positive and you want to verify that, you can email me at this email address and I can help you figure that out. We can share positive results with employers. If you have an employee who tested positive, it is not a HIPAA violation for me to tell you that, yes, that employee did test positive, because you need that information in order to take public health action. You need that information to know that your other employees were exposed and that they need to go into quarantine. So I'm able to share positive test results with you within the last 2 weeks. However, employees can always email this email address, covidtestresults@wycokck.org, to get their results, and then they can give them to you directly if you don't want to go through me for some reason. You can always have your employee email this address, and then they will send the employee the test results, and then the employee can send them to you. If the test was negative, or if it was more than 14 days ago, then we cannot send the results to the employer. We can only send them to the employee. Because a negative test, there's no reason for you to take public health action. So we have to only send those results to the employee. And that can get a little bit confusing, but if you ask me for something that I'm not able to do, then I'm happy to give you instructions on what you should do instead. So please feel free to reach out if you have any questions.
Right. And the next question is, can essential businesses be exempt from following the 14-day quarantine rule?
Thank you. So only hospitals, direct patient care providers, firefighters, police, EMS, and other first responders are exempt from the 14-day quarantine. All other businesses must quarantine exposed employees for 14 days. This is a requirement in Wyandotte County, even if you are designated as an essential business by the CDC. And we have the ability to create stricter regulations in the state within our county.
Great. Thank you, Haley. But that concludes our frequently asked questions. Now I want to turn it over to our other moderator, Janelle Friesen, who is going to go over resources for employers and employees. Janelle?
Thanks, Nicole. Yeah, we'll run through a few different things that you can check out yourself or that you can let your employees know about so that they can get some help, because we know that COVID-19 puts a lot of different kind of strain on folks and has been difficult for individuals, for businesses, and around our community. So first, a few resources primarily for employees. So if some of your employees aren't on health insurance through where they work, then you can always direct them to healthcare.gov, because we know at any time having health coverage is incredibly important, but especially, you know, in the middle of a global pandemic, it's pretty important to make sure that people have the coverage they need. So that's a resource you can always direct people to. Another resource we want to let people know about is that if you're in Wyandotte County and you have any, you know, general questions related to COVID-19, and this goes for individuals and for businesses, you can call 311. And it's a call center that the UG has that's got, you know, people staffed there to answer those calls. They can answer a lot of the questions that people have about COVID-19, and they can also direct people to additional assistance or resources. For instance, if someone wants to be connected to a community health worker, there are several community health workers in our area who help people with number of needs they may have right now. So if someone is, you know, they need help getting food, they need help with their utilities, they need help with employment. There are a number of other resources that community health workers can, you know, walk people through the process of accessing those things. And then again, if employers have questions related to COVID-19, they can also call there to get pointed in the direction to find their answers. All right, let's go to the next slide. We mentioned a few of these earlier, but just to reiterate, we have some forms linked online where you can, for the first one here is if you are with any business in our area and you've got questions about how you make sure your business is aligning with our health orders or any of our latest health guidance related to COVID-19, then you could submit that question at the link there. And we have staff who monitor that, and you know, we'll get back to you about your questions about how that applies to your business. There's also one that Haley mentioned about if you are planning an event of some sort that may be more than 10 people, or otherwise you aren't sure if it lines up with our health orders, you can submit the information about that event and the health department will review it. We may take a look and provide some input on how to make it safer, or, you know, other thoughts on your plan for your event. If you have a complaint, I know the shortened link here says mask complaint, but if there's any complaint related to a violation of any of the health orders, it could be you're seeing a business not complying with, you know, having employees or customers wearing masks. It could be our more recent order with the things like capacity and different hours and that sort of thing. You can submit anything related to the health orders that you see a concern with that through that complaint form. And we have folks like our COVID safety officers that can help make sure that places in our area that may not be following those know what they need to be doing in order to line up with the order. There's also a link here for the Families First Coronavirus Response Act. So there are a number of things through there, including things like provisions for paid leave related to COVID-19. And that may be something that you want to go check out and learn. You know, there's some typical FAQs and questions that are answered on the link here. And again, we'll share these slides after the presentation today, but that's something to take a look at. I know that there was someone in the Q&A who'd asked about if we knew what that's going to look like for 2021. Unfortunately, we don't know quite yet what that will look like for next year, but I encourage you to check in periodically with the U.S. Department of Labor for more information on that. All right, and I think this is the last slide coming up that I have. Okay, and then of course, we have our website that is our COVID-19 page, wykokck.org/COVID-19, which has a lot of different resources if you want to stay up to date on COVID-19 in Wyandotte County. So there are those buttons at the top where you can find information about COVID-19 testing. We have our COVID hub, which is all of our latest COVID data for the county, if you want to kind of see where our numbers are right now. There's things like a food needs request form. We mentioned things like being able to call 311 for help with that. We can also submit that online. We also have all of our latest press releases, health orders, and a number of other resources that are available online. So if you have any, general questions or wanting to learn more about COVID-19 in Wyandotte County, we really encourage you to head to that website. All right, thanks so much. I think we're going to be moving into our Q&A portion a little bit. So got a few questions that we're going to start with here. Haley, we've got a few questions for you to start with. So first, we have someone asking about COVID-19 hotspots. I believe they might mean things related to outbreaks, and they ask what's defined as a hotspot, or a place like a restaurant, for example, might need to be, shut down with a certain number of employee cases. I heard 5 cases makes a place a hotspot and would require that temporary shutdown. Is that the case? Thank you for everything you do to help. All right, Haley, can you speak to that a little bit?
Yep, thank you, Janelle, and thanks to the person who submitted this question. So first of all, an outbreak at the health department, we define an outbreak as when 3 people who work in the same place got COVID probably from each other. Within a household, if I get sick from somewhere, I don't know where I got it, and everyone else in my household gets sick, even if it's more than 3 people, we don't count that as an outbreak. So it's got to be, it has to involve people from at least 2 different households who were together somewhere, whether that was at work, at an event of some kind, at a barbecue, at a Thanksgiving dinner, wherever it was. If there's at least 3 people from at least 2 different households who were there and who could have gotten COVID from each other, then that's a COVID outbreak. So with that said, earlier I had mentioned that even if you have 5 employees at a business who do test positive, we would not necessarily shut that business down. What we would do is we would reach out to them and make sure that all 5 of those employees are in isolation. We would make sure that all of their close contacts are in quarantine. And if that forces the business to shut down because they don't have the employees to remain open, then they might have to close for a while in that scenario. But we would not, at this time, we would not go in and say, hey, you have to close because you had 5 employees test positive. Our emphasis is on trying to educate and help people to stay open as much as possible. We know these are tough economic times for everybody. We're trying to help. And if you have 5 employees who've tested positive, you don't know what to do, please reach out to us. We're not going to come down with the hammer, and try to shut you down. We may ask you to put everyone in quarantine that needs to be. And once again, if that means that the remaining employees are not enough to stay open, then in that case, you may have to close for a while. If you do have an outbreak, what we define as an outbreak, there are more employees who test positive who probably got it from each other. Then we also ask you, what mitigation measures do you have in place to prevent COVID from spreading amongst your employees? And how can we help you improve those measures? Can we put stickers on the floor to help remind employees to stay further apart? Can you have employees wear face shields? Can you add plexiglass barriers between your employees and the customers? How can you increase the number of times you sanitize commonly used surfaces? Can you open a couple of windows? The big main things are wearing masks and remaining 6 feet apart from others. Those are the big 2 things we know that work, but there's all these other peripheral strategies as well. So in conclusion, no, we don't shut businesses down for a certain number of cases. However, they may have to shut down because they might not have enough people available to remain open. Also, in the event that a business repeatedly refuses to follow orders, not necessarily recommendations, but orders requiring masks and requiring social distancing, there are some punitive measures that we may be able to take after repeated offenses. But currently, we have not had to do that at any business. And right now, all we're trying to do is provide education and support to businesses. But in the future, we may be able to write citations and ask businesses to pay a fine if they refuse to follow orders.
All right, thanks so much, Haley. We have a couple questions following up on what you talked about with quarantine guidance and what we're doing locally, following up on the new guidance from CDC. So I'm going to combine a couple of these into one. So just, can you reiterate what our current guidance is in Wyandotte County around quarantine, and then what does that look like around the state? So first,
yeah. So first was CDC, or first was Wyandotte County?
Wyandotte County.
Okay. So Wyandotte County. Let me find a good slide. Here's a good slide. So this is kind of like a trivia question. You may hear two different terms: quarantine and isolation. So what's the difference? Isolation is for people who are sick. And they basically mean the same thing. They basically both mean stay home and stay away from other people. Don't go out of your house. Isolation is the word we use for people who are sick. Quarantine is for people who have been exposed, who are not yet sick. That's a fun trivia distinction. So the quarantine guidelines for Wyandotte County for people who have been exposed to COVID but are not yet sick is that they need to stay home for 14 days from the date of the exposure. So look at day 1 on this calendar, where it says exposure. If I count forward, 1, 2, 3, 4, 5, 6, 7, 8, 9, within that 7 to 8 to 9 day window is when the employee would get tested. And then you keep counting 10, 11, 12, 13, 14. That's the 14 days of the quarantine that they need to stay home. So then on the next day, the day that's actually the 16th on the calendar, they're able to return to work. And if you count the days, then I hope that when you count them, you'll also reach the same conclusion that I did. Starting from day 1, you count 1 to 2, 2 to 3, 3 to 4, etc. So 14 days from the day that you were exposed. And then Janelle, what was the next part of the question?
Okay, so you said then Wyandotte County, we are continuing with 14 days. Is that the same across Kansas and other Kansas counties?
That is a good question. I do not know that there is a deadline for counties to decide whether or not they're going to change their quarantine procedure. And I am not aware of other counties that have concretely decided to go with the CDC guidance. However, there might be. That is a good question, and I will need to maybe follow up with you on that. I don't know what other counties in Kansas. Mm-hmm.
I can speak a little bit more generally to the fact that KDHE, they put out guidance that said that it's up to local county to determine if they will continue with 14 days or if they will use any of the additional shorter options provided by the CDC. And we do know that that Dr. Norman did say that they continue to recommend 14 days, but I do believe some counties have started saying that they may follow the shorter timeline, but yes, there may be some that haven't determined that yet. Okay, I've got another question for you, and this one is about testing. Someone asks, is Kmart the only place to go for COVID testing in Wyandotte County?
Thank you for the question. So no, we have a whole list of testing options on our website. There is, if you go onto our website and you look at the COVID testing page, it gives the address of the Kmart, but also many different places where you can go, including Walgreens. There's a Walmart. There are several pop-up locations that are all marked in a calendar on different days. So I don't know, Janelle, or if we could maybe get the link for that, and then we could put that in the PowerPoint when we send it out, or we can add it to the email when we send it out. So you can click on that link and see all the list of locations within the county.
Sure. It's something that is linked in one of those buttons at the top of the COVID website that we showed at the end of our slides, but we also have a direct link, like a shortened link for it that we can provide for folks. Okay.
Okay. Yep. Is it on this one, Janelle?
Yeah, the last resource slide.
I'm so sorry.
What was that? The COVID-19 test info button there at the top. That'll take you directly to that testing page. And we've got that in English and Spanish. Okay, we do have some more questions for Haley, but I want to hop over to a couple of questions for Chandra so that we can hear a little bit from her as well. So Chandra, there's a question that says, I've heard about being trauma informed and I'm interested in having a more trauma informed workplace, but I'm not sure how to get started. How do you suggest we start?
That is a loaded question. Preparedness is the first thing because like I said, when I did the presentation, that once you know, now you have to deal with it, right? If you want to be effective. And sometimes that can be very inconvenient, especially from a business standpoint, because you actually have to take time to do it. Kind of like with COVID. When it hit, we had to actually take time, get trained and figure out what to do, hit early morning meetings. And I'm gonna relate that to a lot of times we have ongoing trainings and we send staff, but we don't really send management, or the directors themselves or the owners themselves don't necessarily go because we feel like they need that. So when it comes to trauma and how to deal with that in a workplace, I would first suggest that the owners, the management, those who are in position to deal with staff and customers, that they first get trauma awareness. You know, there's different levels to being trauma informed. And the first one is, let's have some training for trauma awareness. What is trauma? What are the reactions? What are we looking for? What do we see? And then we can be kind of sensitive. Trauma sensitivity is like one of the next steps. And understanding, okay, I know that they had some trauma. I know we all are dealing with COVID. I know that family life is going like a certain way. So I know that that's there. So let me give them a moment to work it out. But then we can go and move into what do we do about the trauma that we know that our staff is experiencing. And that's where we become trauma informed and have programs in place to help staff. But if you really want to be effective, it all starts with the basics. Let's get the basics and get that training in there, top down. So as you train those who are under the employees, the frontline employees, then you already know what information they're getting and you all can be on one accord. And it goes back to, like I said, you can get more of a collaborative approach that way, which is one of the steps of being trauma informed. So.
All right, thank you so much. Chandra, I've got another question for you. How does trauma affect interactions with customers? So for example, if there's an angry customer who is not agreeing to wear a mask, practice social distancing, etc.
That question, it's really, how does it affect us? Like we can look at ourselves when we run into people who we consider this is not great customer service, not thinking that they just had a whole, and I'll stick with the days of what we're dealing with now. A family member just passed due to COVID. They can't go to the services. They weren't able to go visit them. And what does that do for us in the back of our mind? Some people are very type A and they just throw themselves into work and don't pay attention. They just keep going, just keep going, just keep going. But where I come from, they used to say what's in you used to come, what will come out. So if you don't learn how to process that and you don't know how to deal with that, then it'll be real easy to lash out on customers when they come in, and your emotional regulation won't be there to deal with the difficult times or even to slow you down and think a little bit. So having coping skills and having things in place to where if I feel safe, then I'm more likely to be able to help someone else feel safe. And if I don't feel safe and you come at me with something and you're really upset, I'm probably going to tap out because at this point I have compassion fatigue and I really don't care about what you're arguing about or what your need is, or I'm going to overreact and then possibly lose my job because I'm just not in a space where I can handle it. So that all goes back to how can we put our employees in a place where they are, and ourselves. You running a business, and a lot of the businesses are reduced time, reduced income, reduced pay. It's a lot of stress. So for us to learn and I think this is where we can bring in like wraparound care. So when we talk about like grant funding and even food resources, like what does that look like to have that available or have that list of resources available for yourself and for your staff? So when needs arise, you know that there is some security there. And there is something that you can look to kind of help. So that again, I go back to if I feel safe, it's easier for me to help someone else feel safe.
Thank you so much, Chandra. All right, we're going to pivot back to Haley for another question. This is talking about if someone is in quarantine and they start having symptoms after 5 days, can they go ahead and get tested? Normally we say wait till around day 8, but if you develop those symptoms, does that change the recommendation on when to get tested?
Yeah, thank you for that question. That's a really good question. So I would say if you start feeling sick on day 5, you can get tested like the next day or the day after that. So within 2 days of you developing symptoms. You might not necessarily have to run and get tested that exact same day, but you can go ahead and get tested the next day or the day after that. So within 3 days of you developing symptoms is fine. If you develop them before the 8-day mark, because some people do start to develop symptoms around day 5. We know that statistically, if you were exposed, if that exposure source is the source of the COVID that you have, then it's more likely for you to get an accurate test on day 8. That was a little bit confusing. If you're sure that you were only exposed to that one particular person, and you're definitely sure that that's the person that exposed you, then day 8 is still going to be your best likelihood for an accurate test. However, because community spread in Wyandotte County is so wide, you could have been exposed otherwise than that particular person. So I would say if you start feeling sick, you can get tested within 48 hours of when you notice your onset of symptoms, and you don't have to wait for day 8.
All right, great. Thank you so much. All right, and we have another question that came in for Chandra, asking if you have any training materials that employers can use to help educate individuals in management to navigate and assist staff during this pandemic.
We do, actually. We have a lot of training materials. So if you want to reach out to me, my email was on a few slides back, and a phone number. It's chandra.green@wyandotte.bhn.org, and it's Wyandotte, WYANDOT, BHN.org. You can contact me and we can talk about what type of training materials you're actually looking for and what that looks like for your organization. I will also say that along with the training is assessing your organization and assessing what trauma, what level you're at with trauma response. So be ready for honest answers from your employees when you have those type of situations.
Okay, thank you. All right, Haley, you talked today about what's included in the most recent health order, so people know what's covered in that, what they need to know. But can you talk a little bit more about why restaurants and bars are required to close after 10 p.m.? What's the reasoning behind that piece of the order?
Sure. Thank you, Janelle. And thank you to the person who submitted this question. So to speak frankly, we know that when people are gathered together late at night, especially when there's alcohol involved, they're less likely to take precautions regarding social distancing and mask wearing, and they're more likely to be able to socialize with people who maybe they didn't come with to the restaurant or to the bar. They might mix social groups, and that's really what we're trying to avoid, because that's how we know that COVID spreads. Especially, I don't know if you guys remember, this was back back at the beginning of the school year, but out in Lawrence had a lot of problems with students at KU getting COVID after they had gone to parties at bars, and they were unable to tell like who they got it from. And now I'm not saying that people in Wyandotte County are having crazy parties or anything like that, but just that we know that when people are at bars late at night and alcohol is involved, they're less likely to take precautions, and that is a place where COVID can spread easily. Within this age group of people in their 20s, they're working, they're going to work, they're maybe living in multi-generational households with their parents and grandparents. Maybe they work in long-term care facilities. That's true for older people too. But within this particular age group, they're less likely to have severe symptoms of COVID. And so not only are they're probably more likely to be at bars and maybe partying and maybe not being as responsible late in the evening, but then they turn around and take it with them to their places of employment or back to their homes and their multi-generational families. And so we've identified this group of people and this particular type of exposure as a source of community spread. And if we can limit community spread at bars and restaurants in particular, that's one way we can try to limit COVID spread in the community.
Thanks, Haley. I wanted to also ask you a question about testing. So people hear about different kinds of tests, things like rapid tests or ones that take longer, or antigen tests versus PCR tests. Is there a certain type of test that's most effective?
Yeah, oops, I was going to even type it out for you, but sure. Let me even type it out for you so it's easier to see, so everybody can see. So there's kind of three big types of testing. There's PCR, there's antigen, and there's antibody testing. Okay, so let me start with antibody. Antibody testing is trying to determine if you had coronavirus at some point in the past, whether recently or quite a while ago. So the test is looking for an immunologic response that your body produces after you become infected with the virus. This testing we do not condone. We have not found as a health department that these tests are reliable at determining that you did have coronavirus, or at determining how long ago you had it, or if determining if you're immune to having it again in the future, because we know that you can get COVID twice. And so the value of antibody testing is really limited because we're not convinced that it's very specific to COVID-19 in particular. And we're not convinced that it gives you information of whether or not you can get sick again. So this one, you can certainly get antibody tested. And if it comes up positive, it may mean that you had COVID at some point in the past, but we're just not confident in throwing institutional support behind that, given the tests that are currently available right now. So we don't recommend relying on antibody testing. Antigen testing looks for a marker on the virus itself, and antigen testing is normally rapid. So there are rapid antigen tests and rapid PCR tests. Right, so antigen testing is looking for a part of the virus itself. And the way that the antigen tests are done, they are more likely to be accurate within the first 5 days of symptom onset, but even during that period, they are less accurate than PCR. So what I mean by less accurate is that if you're really positive, you may get a negative test too often, or if you're really negative, you might even get a positive test when you don't actually have it. So these tests are not recommended either because they are not accurate, not as accurate as PCR tests. I'll say that here, not as accurate as PCR. And there is some use for antigen testing because it is so fast. Some people like using it to do screening, like to test a big group of people. And then if you get any positives in that group, you might send them to get a confirmatory PCR test. But really, I wouldn't rely on the results of an antigen test to tell me if I have COVID or not. If you do get an antigen test and it does come back positive, I think the safest thing to assume is that you do have COVID, especially if you were exposed and you have symptoms. But no matter what your result is from your antigen test, we would encourage you to get a PCR test. PCR testing works a little bit like this. The virus has an RNA component, a genetic component that we can copy and multiply to determine if you have the virus in your system. And that process is called PCR. This process is very, very sensitive, meaning that it can pick up very, very, very few copies of the viral RNA to show that you are positive. So this one is the most sensitive of all of the types. There's no such thing as a false positive, PCR test. And this is a little bit confusing. You may have seen on the news recently that there were some Chiefs players who got positive tests and then they got tested again and it was negative and there was a whole thing and the news was asking like, oh, maybe there's false positive tests out there. But from what I understand, those positives were due to a clerical or computer error and not due to an error in the test itself. If you get a positive PCR test, that means that you have coronavirus. There's really no, as a health department, there's really no such thing as a false positive PCR test. However, you can get a false negative. You can get a false negative test. Like I said before, the likelihood of that is lowest day 8 after you are exposed or between day 1 and day 3 after you start to develop symptoms. And so that's why we really hammer home this, please get tested 8 days after you were exposed to minimize the risk of getting a false negative test. But PCR testing is the gold standard for COVID testing because it is the most sensitive. And per our understanding, it is the most accurate. I did also want to note that there is rapid and 24 to 48 hour. They don't call it slow testing, but there are both types. And so rapid and 24 to 48 hour, we have the 24 to 48 hour test at the health department. That's how long it takes for our results to come back. But some places like KU Hospital and some urgent cares will have rapid PCR. So if it's rapid PCR, it's just as accurate as the 24 to 48 hour turnaround PCR. Antigen is less accurate. Please go get another test. And then antibody testing, we don't really recommend it. You can certainly get it if you'd like. I hope that answers the question.
Thank you so much, Haley. Yes, that does answer the question. We are getting near the end of our time. I'm just going to hand it off to Nicole to wrap us up.
Thank you so much. And again, I learned something else new. Thank you, Haley, for giving us that sort of quick tutorial on testing. And hopefully you found that to be interesting and informative. I certainly did. So again, I'm always learning something each and every day. Again, this concludes our business town hall meeting. We really appreciate all of your great questions and joining us this morning. And we thank you again. Please send us emails for future presentations or things that you would like to learn more about. And have a wonderful and safe afternoon. Thank you so much.
Thank you.
Thank you.
Have a great day, everyone.